According to the CDC data surveillance team, as of June 29, 2020, a total of 2,545,250 total cases of COVID-19 were recorded in the US, and an alarming 126,369 total deaths were attributed to COVID-19. That is equivalent to 42.5 times the amount of casualties recorded in the tragic events of 9/11. In my speech, I will be discussing COVID-19, and by the end of my speech, you will know the truths regarding the transmission of COVID-19, symptomology involved, and the best means to prevent COVID-19. I am a registered nurse at ORMC, and I've had the opportunity to work as an infection prevention officer. I'm an advocate to my patients, but also to my community. In this speech, we will be discussing the transmission of COVID-19, the symptoms involved, and the best means to prevent transmission. And now that we know the main topics, I'd like to focus on the means of transmission. How is COVID-19 transmitted? Well, according to the AARC Times, author of the journal article, How Long is Coronavirus Stable on Surfaces and Aerosols, written in 2020, it was found that coronavirus was spread by droplet and contact. What is droplet and what is contact? Well, droplets are produced when an infected person either coughs or sneezes, and either aerosols are suspended in the air or infectious particles fall onto surfaces, contaminating them. And you may ask, how long is the virus viable on these surfaces? Well, in aerosols, the virus is viable up to 3 hours. On cardboard surfaces, up to 24 hours. On copper surfaces, up to 4 hours. And on plastic and stainless steel surfaces, up to 22 to 3 days. This brings me to my topic of cross-contamination. Well, what is cross-contamination? Cross-contamination is when you touch an infected surface, and then you go onto your phone to text your friends, and then you get a call, and now that you've touched the infected surface, and you've touched your phone, and you've touched your face, the infected particles are on your face and close to a portal of entry. Now that we know a little bit about transmission, I'd like to focus on symptomology. You may be asking yourself, how can this affect me? According to Zhang and his research team, the author of Review of the Clinical Characteristics of Coronavirus Disease 2019, written in 2020, he found that the most common symptoms related to COVID-19 was fever, fatigue, and dry cough. Other symptoms involved include malaise, diarrhea, shortness of breath, congestion, loss of taste and smell, and headache. The incubation period lasts between 2 to 14 days. Now, what is the incubation period? The incubation period is the time between a person becomes infected to the time a person becomes symptomatic. And even in asymptomatic cases, a person who is infected and asymptomatic is still able to spread infection. Now that we know how coronavirus can affect a person, I'd like to focus on how to best prevent transmission. How do we prevent transmission of COVID-19? Well, according to the author Jordan of the journal article Coronavirus, Infection and Control and Prevention Measures, written in 2020, it was found that hand hygiene and alcohol-based hand sanitizers were the best means to prevent infection. What is hand hygiene? Well, hand hygiene, when using soap and water, you have to rub hard on all surfaces, reaching all surfaces for at least 20 seconds. And when utilizing alcohol-based hand sanitizer, you have to rub on all surfaces, including the wrists, including underneath the fingernails, until the alcohol-based hand sanitizer is completely dry. Additional measures are barrier measures and the use of personal protective equipment, or PPE. PPE includes masks, gowns, and gloves. But one thing I do want to mention with gloves is if you are not changing your glove or doffing your glove after you touch a contaminated surface, then they are not useful and you are practicing cross-contamination. Additionally, I'm sure we're all familiar with the term social isolation and social distancing. Why is that important, maintaining a 6-foot distance in public spaces? Well, a person is more likely to come into contact with aerosolized infectious particles or droplets if they are within a 2 to 3 foot distance from a person from a 6 foot distance. Now that we know about prevention, I'd like you to remember this the next time you're in a public space or in the safety of your own home. COVID-19 is transmitted by contact and droplet. The most common symptoms are fever, fatigue, and dry cough. And the best means to prevent transmission is hand hygiene and the use of alcohol-based hand sanitizers. Now, a quote from Professor John Oxford resonated with me, and it reads like this: "We come from a world of infection. We live in a world of infection, and in the future, unless we take control of infection, we will continue to live in a world of infection." To me, that means I'm responsible, you're responsible, and collectively, we're all responsible to prevent transmission and therefore decrease mortality.